And I'm going to go ahead and start the recording. Okay. Welcome, everyone, to Walden University's second Advanced Doctoral Mentoring Masterclass in a series for faculty who mentor students with specific needs. The masterclasses are designed to allow faculty who have been identified as exceptional mentors to share their experiences and insights with the mentoring community. Today's session will be an advanced mentoring masterclass, recruiting research participants with a disability. The purpose of this class is to have staff and doctoral mentors discuss how they help students to recruit participants with disabilities. And the goal for this session is to provide a list of usable strategies for faculty to apply to their mentoring. You'll notice that we are in a webinar room today. So we do have the chat available for questions or comment throughout the presentation. And then at the end, we'll have some time to open it up if anybody wants to get online and talk through any questions or comments. So you may be wondering who's presenting today. This is our list, our moderator and our panelists. So our moderator is Dr. Lee Stadtlander. And we do have our panelists here today. We have Dr. Ethel Perry, Dr. Leilani Gjellstad, and Dr. Jenny Sherer. And I think at this point, I'm going to go ahead and hand it over to Lee to take it away.
Thanks, Matt. So I'm Lee Stadtlander, and I'm the coordinator of faculty research training in ORDS. So let's introduce our faculty. Ethel?
Hi, I'm Ethel Perry, and I'm contributing faculty with the PhD psychology program, the College of Psychology and Community Services. And just a little bit about me, teach several other research classes, qualitative, as well as I serve as chair and second committee member.
Okay. Leilani?
Hi, everyone. My name is Leilani Gjellstad, and I have been the chair of Walden's IRB for a couple decades now, and worked in a couple other roles in assessment and evaluation at Walden. And I teach occasionally in the School of Psychology as well.
And Jenny?
Hi, everyone. My name is Jenny. I also work in the Office of Research Ethics, Compliance, and Partnerships. I feel like our office name grows as we grow as well, most oftenly known as the IRB. I've been with Walden since 2006 and with the Research of Ethics and Compliance since 2008. And I also am on dissertation committees in the School of Psychology as well.
Very good. Well, let's start off with, there does seem to be a belief for some faculty that students should not have participants with disabilities. They often discourage them. And some of the reasons I've heard was that there were ethical issues and difficulty recruiting. So initial thoughts, do you think that they're a difficult group to get into experiments or studies?
Well, my initial thoughts, there are certain groups that are difficult to recruit. I know I have several students who are trying to recruit indigenous populations from Canada. And the specifics behind this, it was a quality study, and they were trying to recruit those individuals who were parents of children with FASD and talking about stigma itself. And so because of that type of disability, although this particular student actually was considered part of that in-group and could speak the language, there was the difficulty of the shame that was faced with this disability. And because of the shame, it took some months before this particular student was able to even recruit, ended up with 6 participants. And so those months became like almost 7 months, which was some time in order to get the participants. So that was the difficulty of that.
Yeah, I would agree. I think sometimes students don't always understand the challenges involved in identifying and connecting with certain groups, or they overestimate the size of the population. They've been working on something for months, years, or they are personally involved in it. And so they think everybody is as knowledgeable and is interested or just has that connection. And they don't always understand that it's quite difficult for any population, much less a very specific one. And one like Dr. Perry had mentioned, that sometimes they are ashamed, or they're ashamed about the topic. They don't want the topic to be affiliated with them, or how it could make them look. And so they underestimate some of those challenges of connecting and getting their foot in the door, to really be seen as somebody that's there to record their stories, not to reveal their deepest, darkest secrets.
These are all really important issues that they're raising, and we did a survey of alumni early last year, and we asked them how many people they had to invite in order to get enough volunteers for their studies. And that was eye-opening. In fact, we're trying to get the word out as much as possible that it was a majority, 60, high 60s, 68%, I think, of the alumni said they got fewer volunteers than they anticipated. And we asked them to give actual numbers. How many did you invite? How many volunteers did you get? And then we calculated some percentages, and we found that the normal or the typical experience is to have a volunteer rate of about 10 to 25%. So that means if you need 10 interviewees, for example, there better be at least 40 people that you can identify to invite who meet your inclusion criteria. And if you happen to be recruiting people where a group where there's some stigma, it's possibly even more toward the low end. So if you need 10 volunteers and, only if we're extrapolating and only 10% volunteer, that means you need to have a potential pool of at least 100 people who meet your inclusion criteria. So that means there's a real danger in, like if you were looking at people with, I think you said FASD, then you wouldn't want to say people with FASD in just this one province or with just this one community, because that really narrows your pool dangerously small. You need to be thinking about, okay, I need to figure out, okay, a pool that has at least 100 people if I need 10 interviewees, roughly, and then work from there. And if there simply aren't 100 people who meet that set of inclusion criteria, then you need to broaden the scope of the study and maybe go, if you're in Canada, nationwide in Canada, or even consider, well, what if it is not limited by nation, to really think, especially for qualitative studies, as that you're setting the bounds of your study, to be thoughtful about it from a pragmatic perspective, because the danger we see with people, with our student researchers, overestimating how many volunteers they'll get. The danger is that as they recruit and get a little more desperate, so to speak, that's when the danger of coercion and inappropriate leveraging of relationships or inappropriate leveraging of services. So, recruiting people, we'll probably get to it in just a moment, but, recruiting people through the organizations that serve them, or the therapists or the physicians or the other providers who serve them, can be wonderful, but we have to be really careful about the power dynamics there so it doesn't become a coercive type of dynamic.
Awesome. That's really great information, I think. So what kind of types of disabilities are coming up in recruitment at Walden?
Well, some types of disabilities that I can think of from the research my past students have done, one has been in regards to looking at individuals with various autoimmune disorders, such as rheumatoid arthritis or Addison's disease or psoriatic arthritis, and where it was so severe where they also had other comorbidities along with that, such as individuals with the Addison disease or some form of arthritis may also have uveitis as well along with that, which caused a loss of part of their eyesight. So which meant that was another disability with that disability. And so in looking and saying all that, with those populations there, the recruitment can be somewhat very difficult because of the fact that if you're not part of the in group, then they will be more likely not willing to do the interview. So, so that's the biggest thing, is that all my researchers, the students actually were part of the in-group, which made it very easy or easier for them to be able to recruit some of these difficult populations. But also have had other people with disabilities, such as young college women with cancer and their in regards to stigma and hair loss.
Those do sound tough to get people.
Yes.
So yeah, that's an interesting one to bring up because, and maybe we can talk about some of the range of disabilities and the degree to which some disabilities impact cognitive abilities that get into capacity to consent, whereas many disabilities or challenges that are hopefully temporary, like cancer, it's not, well, I guess it is possible that that cognitive capacity could be impacted if someone's in the acute phase, right, of being treated. But that's really something for a student to very carefully consider in terms of whether or not they're being recruited through their provider's office, because then you have a power dynamic that makes them truly more vulnerable. Because if your provider, and the IRB works with the student researchers on how to facilitate the invitation in a way that it's sort of low pressure. And it's not your provider saying, I really want you to do this study. The researcher is a close personal friend of mine. Or even worse, we don't allow researchers, if they're the provider, to recruit their own patients. But you could imagine how much pressure you might feel if your own therapist or the person who's been providing your family, your loved one with chemo. And so actually that's another issue. Sometimes our researchers are wanting to recruit a family member or caretaker of someone with extreme disabilities or a chronic illness. And so we think about the disability or the illness itself, and how does that impact their well-being? Does it make them more vulnerable in terms of the services they're receiving? Is the setting also contributing to their vulnerability by, the way the invitation's coming to them is through a provider or someone who provides services that they rely on or that they value, and they might be afraid of losing that person's, they might be afraid of disappointing that person. And of course, we also need to consider, does the disability itself involve cognitive limitations where we have to be thinking about, does this person possibly have a legal guardian who is part of the decision making and the consent process? And even if it's not as extreme as them having a legal guardian, in some cases, we still might have, with certain types of disorders, like with substance dependence, for example, we might include in the invitation process, please discuss this with either your sponsor or your therapist, your counselor, before you make a decision about the study. And that's not for every single study. It's kind of on a case-by-case basis, because some types of interviews, for example, maybe would, if they were really getting into the substance use and relapse, that it really should be done with the knowledge and support of a sponsor and some sort of counselor. And so those are some things to consider.
Yeah, I would add too that there is a wide range of disabilities that come through, and that's a great thing about Walden is we get students with so many different interests. But the flip side of that is that there are some students that tend to think that a particular, there's a sense of homogeneity within a particular disabled status. For example, maybe a learning disability. Autism spectrum disorder is a big one that we see quite often. And there's a full range of capabilities and mental competencies associated with that. And the difficulty is there are a lot of students that are wanting to have it be a little bit more open. They, again, going back to how can I find my participants? If it's broader, I'll be able to get more participants. But there are inherent differences between people that are on one end of a particular spectrum compared to people who are on a different end. And there are practical issues, not only, maybe, again, just taking the autism spectrum disorder as an example, clearly people that are on the extreme end of needing parental supervision or guardian supervision well into later ages of their life, that's going to be very different compared to very high functioning, where really within the typical world, people don't even know they have autism because they've managed to find how to live and thrive within mainstream society. But at the same time, to just say, I want people on the autism spectrum disorder, well, there's a lot that needs to go with that. And sometimes, we just talked about, sometimes you need to broaden your inclusion criteria to be able to reach your sample size. But at the same time, sometimes you also need to narrow it to make sure that you really risks associated with potentially recruiting the most vulnerable participants associated with that particular group. And so it does sometimes require, maybe, okay, I am only going to focus on those that have this higher functioning or have less of a debilitating occurrence because of what's happening. And again, that's not always the right answer, but it is just one other thing to consider is recognizing that they're not all the same, despite having what's, the disability with the general group.
Yeah. Earlier, Leilani mentioned about caregivers. Are they considered vulnerable in any way? I mean, is it better to go with caregivers?
Yeah, and that's a really that can go a long way too, because we don't always know who the caregivers are, even who is the legal guardian. Sometimes it's very obvious. It might just be a parent, but when you get into, it's possible that they might be wards of the state if they're living in some type of institution. It's not uncommon for certain institutions to have the legal capacity to make those decisions. So that actually gets into an entirely new set of concerns that can be very difficult from a legal perspective for a student to navigate, for no more difficult reason in that each state is also different as who can provide that legal authority. And so if they're looking at conducting a multi-state study, they would have to find what the laws are for each and every state to get that understanding of who would need to be that. And then on top of that, we also need to consider, is it possible those legal guardians have their own vulnerabilities and disabilities we need to consider? So yeah, it will definitely, it's one of those where if that's a path a student wants to go down, we're kind of looking at the feasibility standpoint of how long is it going to take them to find out all of that information? Is that is that something that can be done in a reasonable time frame for their dissertation?
Yeah, and there are a number of times, since you brought up caretakers, quite a number of students have come into our program and their passion is children with some sort of chronic illness or disability, and and great research questions. And sometimes it is possible to collect data directly from those children. Other times it becomes more feasible. Parents of children with disabilities are obviously extremely protective, and talking about the disability can have a ripple effect and a lasting impact. And so there have been many times when a student started out wanting to collect data directly from kids and maybe shifted the study at some point after considering these types of factors, and shifted the study into more of a maybe a 360-degree, interviewing providers and parents, or maybe providers and teachers and parents. I mean, we've seen some really creative configurations, ways to get data about the experience of the children without risking interviews that could be stigmatizing in and of themselves. And in fact, some of the calls, I'm the research participant advocate most of the time that is on the consent form, and frankly a lot of the calls I get are from situations when a parent is, this study is about kids with XYZ, and I want to make sure this isn't going to pop up on YouTube someday, or this isn't going to somehow stigmatize my child. Is this in any way getting into their school records? That's the kind of assurances they'd be looking for. But at the same time, parents often feel more comfortable volunteering themselves than saying, oh, sure, talk to my kid about what it's like to grow up with sickle cell anemia, or what it's like to grow up with, you know, some other challenge that, you know, they may just not feel comfortable putting their kid in that position to be interviewed about that.
You brought up an interesting point, and I want to extend it a little bit. You know, I do a lot of research with elderly people, and one of the things that we always warn students about with them is that you have to be aware of the possibility that they bring out that they've had some kind of abuse from a caregiver or something like that. And we talk about, what are you going to do about it if that happens? What happens with people that are physically disabled? I mean, is that a concern with them, with caregivers? I mean, I don't know if the law covers them, do they?
I think it is going, again, you're looking at state regulations, even mandated reporting from a child perspective. Not all states consider all people to be mandated reporters in that regard. Some states have such law, other states only certain professions have to report child or elder abuse. And despite, in addition to, regulations and laws, there are certain, just as a researcher, as a human being, what are you comfortable accepting? Just because there's no law that says you have to report, doesn't mean that if you learn that there's a threat of harm, again, yeah, obviously as a researcher, you need to stick to what you say you're going to do, but that's where just having that mindset and that preparation ahead of time can be so important. Because if somebody knows, if I learn that somebody is hurting you, I'm going to have to report that, stating that up front can be very important. And a lot of times students just don't think to ask those types of questions or believe that those types of situations could come up.
But often when you do bring that up, that I have to report that, if there is a problem, that may bring it out, that I have been getting abused by my child or whatever. So, yeah.
Yeah, and we, one, I think, popular misconception amongst our student researchers and even some faculty is that IRB requires you to report everything. And actually, in the history of research, we've learned, especially in the social sciences, that if you don't offer people confidentiality, they're not going to be honest with you. And the research, therefore, is kind of pointless. Not pointless, but it's limited and it's not as authentic. So anytime a researcher is able, or put it this way, if it's within their legal capacity as a researcher to offer complete confidentiality, that would usually be the IRB's preference. Though, like Jenny said, if someone said, no, personally, it's just a deal breaker for me if they mention something, and people have different deal breakers, right? There are some people who are deal breakers about illegal drugs, or there's some, their deal breaker for a lot of people, it's children, right? But there are other types of situations where a researcher might say, I want to know the absolute truth, even if it's somewhat ugly truth. It's not going to be the IRB that compels you to make some sort of report. We would tell the researcher to really think through every possible scenario, given your interview questions. What could people disclose to you that possibly gets into violations or law breaking, or even ethical code breaking? And then carefully consider, are there any possible exceptions to confidentiality? And if so, then you need to state those exceptions up front. And for most of our researchers, I think most researchers stick with, well, I wouldn't tell anyone unless the law compelled me to do so, which is what we're talking about with mandated reporting. And like Jenny alluded to, it gets so tricky in those states where everyone is a mandated reporter, not just teachers and other care providers. So we have in our IRB form a list of those states, and it could change at any time. But I think when people are doing social science work in their various states, they are usually pretty familiar. If your teacher, all you have to do is look at your licensure requirements, and same for any field. There's a state board, and they make it clear what your mandated reporting responsibilities are. But I think a lot of people are surprised to learn in those states where everyone's a mandated reporter, they're often an average person wouldn't know that. So that's part of what the IRB process would cover with them.
I want to shift gears a little bit. Ethel, when we had talked earlier, you mentioned about that students have problems sometimes when they have the same disability that they're researching. I just wondered if you could talk a little bit about that.
Yes. So if they have the same disability that they are researching, we will talk through that. Number one, you do not want their, especially doing qualitative research, you do not want any of their issues or biases to enter into the research itself, and how to go about journaling or keeping a diary of that. We also will talk about the questions that they may be asking, how those questions are constructed, and whether or not, if those questions will cause them to have any type of feelings, because that's important to know. And so the committee, actually not only myself, but the committee member as well too, we will talk through that and to see what that scenario looks like. We strongly encourage to do a pilot study, a test run, maybe with family and friends who can give feedback to the questions. If they're going to do pilot study with a real participant, then they have to wait till they get IRB approval for that. We also will talk about at the very beginnings, during the prospective stage, just the feasibility of this. Let's talk about this study. So if you're too close to it, that's a concern of the committee. And so we would suggest, let's look at a different research problem for you to take a look at.
It's really good. Yeah, I've seen that happen. Even when people are doing something like domestic violence, if they have a history themselves, it can be really devastating to hear those stories again. Okay, so what do faculty need to be aware of if students are going to be recruiting disabled people?
I believe one thing that faculty would need to be aware of is, number one, at the very beginning, as I stated earlier, it's just that the feasibility of this study. Is this a study that's feasible? And if not, then you need to take a look at a different research problem. If it is, then how will you go about recruiting these participants? Where, what's your plan? Where do you plan on getting the participants from? That's another concern. For other circumstances, is that to be aware of is when they get to the interview process, you really want to take a look, if you're doing a pilot study first, you want to take a look at the interview, the transcript, listen to the recording, see how that was done, give feedback. And even when they get to the actual study, once again, you don't want them to do 5 interviews and you haven't listened to the first one, to take a listen to the first interview, to read the transcript, see what some of the challenges that they have. Ask them what were some of their challenges. Ask them what did they do well. You also want to be aware of whether or not, if they felt as though the participants were struggling during the interview or having difficulty answering the questions. And if they find like 2 or 3 having difficulty answering this question, or they become very tearful, then we want to talk through that.
Very good.
That's such
Jenny?
great advice. Yeah, no, it's such great advice. And piggybacking off of something Dr. Perry shared at the beginning, was thinking through those recruitment plans, is have a backup plan and a backup to your backup. Again, it's students go in with the best intentions, and it's great. And even those that have a foot in the door or have a way to, integrate, sometimes it just doesn't work out. Social media has been a great boon to recruitment and recruiting from very geographically diverse areas, reaching populations that might have been kind of inaccessible in the past. But it's not a it's not a cure-all. And despite, being able to post or do different things, sometimes it takes having a backup plan and having something else in case that fails. And just kind of just that tenacity of sticking with it and just kind of understanding recruitment will be hard, probably more hard than most anything else at that phase, because they're so excited to get started, and it can be very deflating when they don't get anybody or they only get one or two people, and then they're at a loss because they're so involved. And it's very easy to get that tunnel vision of, well, I have to do it this way. I can only do it this way. And the more you can think and be flexible on the front end and build that into the study, just helps prepare students for those worst case scenarios. Best cases, you don't have to use them. It's great to not have to use those backup plans, but thinking of them on the front end can save a lot of despair on the back end. And then the other thing I would add is just remembering the spectrum of who is involved within a particular disabled population, and really considering, is it necessary to include everybody that's within that spectrum? Is it possible to focus on those who are maybe less vulnerable within a population? Considering what makes a particular group less vulnerable, and how might that impact the overall study? If it's necessary to include the more vulnerable people, really kind of pushing them as to why, and not like in a combative matter, but more of a information seeking of what is it that more vulnerable group can provide that a less vulnerable group can't, and really helping them see the benefits, because there's going to be more risk involved with a more vulnerable population. So then they also have to understand, what are the benefits? How is it more beneficial to the study to include them despite those increased risks? And really just being purposeful as they're thinking through some of those questions, rather than just, this is just what I want to do. We'll work it out later.
And she brings up a good point, in that I remember with one student who was doing her study with the FASD, but looking at it through the lens of the parents itself and stigma for that child in the elementary school. However, although she was dealing with the Canadian Indigenous population, one thing that we learned is that we didn't take into consideration the community, how they felt about the study. And so she got multiple, I guess 3 or 4 calls from tribal leaders, as well as some males in the community, who actually stated to her, shame on you for doing this study. Because within that community, that's so secretive about the FASD. We see it, but we don't see it. And so when it comes up, that's a shame. And another thing that she learned in trying to recruit this population, most of the women had to ask permission, if they were married, of their male partner or their, yes. So that came up as well too, which we found quite interesting.
I would just,
what?
oh, sorry, go ahead.
That's okay. Did you want to comment on that? I had another topic, but
Yeah, no, I was just going to piggyback, is that what that experience with Dr. Perry's student is so applicable in so many other scenarios as well. Not just to get their perception on, what their thoughts on it, but also just how can the study practically be accomplished? People that are within that community understand the people and understand what they're afraid of, what they might be willing to do, and can really provide some very valuable feedback to students about issues that they should be considering, that might not be things that are necessarily asked in an IRB application or asked as part of the proposal development, but can be really critical as they're developing overall, to get that sense of understanding from those that really know best.
Leilani, did you want to say something?
yes, I just wanted to underscore what Jenny said earlier about flexibility. Having a backup plan and another backup plan, but also committees. Sometimes we as faculty also need to be flexible. Here's a good example. I know we would all prefer for our students to do face-to-face interviews. That we can all agree that's the best, that's ideal. And when you can't do face-to-face, we really want them to do Zoom or, you know, something with a facial component. But the reality is that phone is a lot easier for people. And when you're talking about people with disabilities, there's a number of reasons why even Zoom is difficult or a barrier. And so having open-mindedness about, well, at least if you get them on the phone, that's still something. And you can build a good rapport on the phone. It's a little different, sure, but people have been talking on the phone and building relationships for many decades, right? So it's and during the pandemic, we all had to just roll with it and be as flexible as we could. And I think it really was in some ways helpful overall, as some of us had to adjust our expectations of what a so-called good interview looks like, and be open to you know, either what I often recommend is by all means use Zoom, but also give the phone option if for some reason they don't want to share their surroundings or their face. And with disabilities, there are just many, many reasons why that could be a factor for them. And that would be an interesting study, wouldn't it? What are some of the barriers to volunteering among people with disabilities? And I think the format of the interview makes a big difference. And in some cases, even though it would not be my preferred format for qualitative, in some cases, having written open-ended, like typed up open-ended responses gives them more anonymity, or in slightly more extreme circumstances. This doesn't particularly come up with disabilities, but when people are involved with illegal activities, we often encourage researchers to set up a means by which people can take part in an interview truly anonymously, so that names, certainly not faces, are shared, that there's a number or a link to connect to and people can talk. Names are never requested, and there really is no way to tie their identity to the data. And for anything involving stigma, I think researchers might want to at least consider that.
Great option, yeah. Anyone have any questions? We just have a few minutes left.
And as Lee put in the chat, if you do have a question, you can raise your hand and then we'll go ahead and unmute you.
One issue I had recently come up with a student, she wanted to look at cancer survivors and how they talked about spirituality with their doctors. Well, it turns out people don't do that. And she was recruiting and she could not get people. And it wasn't until she broadened that quite a bit of, you know, how did you interact with your doctor, and would you have liked to have talked about spirituality, that we finally got enough people. But it took a long time. And I had never thought about it before, but it makes sense that they probably wouldn't want to talk about that.
I have one sort of catch-all topic to add if there's a moment. And that is a common misconception that a lot of students sometimes assume that they are required to screen out people with disabilities from their sample. And they mean well. They sometimes assume that's a protective thing that I'm offering. Whereas the wording in the IRB application is actually saying if people who happen to be vulnerable, including people with disabilities, if they happen to volunteer, are there any, particular considerations? Do the benefits still outweigh the risks? And so I have it as one of those things it comes up so frequently. I have a copy and paste kind of generic response. And in fact, let me see if I can share this part of my, I'm just going to share the part of the IRB application where this is covered. It's number 16. Can you all see that?
Not yet. There it is.
Okay. So that's the part of the application where it asks if people who have disabilities or anyone who might be vulnerable happens to volunteer for the study, do the benefits still outweigh the risks? And so what the IRB is looking for here, and what we can help students with figuring out is, given their disability, their voice is probably, it's even more important than that they be heard, right? We don't by any means want to exclude people with disabilities, because every once in a while, like I said, people, researchers, meaning well, will have some screening questions, and intending to, keep them out, but we want their voices to be heard. And so, and in some cases, it really is a dialogue to happen between the student and their committee. I can think of a few examples with mental health types of studies where there might be certain comorbidities where you really want to rule out, you want to just focus on people who have this but not that. So those have been some situations when it really did make sense to exclude people with a certain disability, but it's pretty rare. So and anytime, a faculty member's in doubt, of course they can always reach out to IRB or just send the student to IRB office hours to talk through it with one of the IRB members.
Awesome. And so we should mention that the IRB has daily office hours, and faculty as well as students can come and ask questions. I think it's such a great thing that you guys are doing with that. So any last comments anybody would like to make? Anything that you would like to touch on before we go?
I think one last comment I have is what has been echoed throughout, is that one, talk about the feasibility, of the study at the very beginning. There the prospective stage is ideal. And two, have a backup, plus another backup plan. And like I encourage my students, go to the IRB. If you have a question, that's IRB, go to the IRB office hours. And so typically they do, so that we don't have to visit this when we get to chapter 3 or when we get to the data collection phase.
Awesome.
Yeah, I would add it's never too early to begin conversations with other people that can intelligibly inform on how the study could be practically accomplished. If there's an organization that you could possibly conduct your study with, talk to them early and often. They're in a great position to provide feedback, again, about the practicability of reaching that population. If it's looking at maybe social media, having contacts, communication with moderators of particular groups, if you're looking at reaching specific groups, to see, does this work? Do people even respond? Or is there language that I should be mindful of that I should either use or avoid entirely? And really just taking those viewpoints into consideration, because all of that, again, feeds into some of the specific details needed to conduct the research. But the more they're thinking about that at the earliest possible phases, the more it can start being internalized as they apply it to their study.
Great advice. Awesome. Leilani, any last thoughts?
No, I think we've done a pretty good job of covering it, but I'm glad we have more follow-ups with to talk about vulnerable populations that are elderly and might also have disabilities, because that's or military veteran populations that might also have disabilities, because that's where there are a few other extra considerations to keep in mind.
Absolutely. I want to thank my panelists. You guys were so awesome. You really were very knowledgeable, and so appreciate your expertise. And Matt, thank you. Appreciate you.
Very welcome.
And again, if there are tips or ideas that you would like to see included in our doctoral mentoring guidebook on this, please feel free to send them to me, and I will add them in and give you credit. Thank you, everybody.
Thank you.
Thank you.
Bye.
Bye.
Bye-bye. Thank you.